Why are they quarantining 153 kids in South Carolina? And why is it they have to do that if 91% of the people are vaccinated in one of those counties? I'm Dr. Terry Simpson. If you want to learn more about evidence-based medicine, give me a follow. It's interesting that in the Spartanburg-Greenberg area, you have some of the lowest vaccination rates, and it's around 91%. But it takes at least 95 and preferably 90% vaccination against measles virus to get herd immunity. And even though vaccination is 97% effective, measles is probably one of the most contagious viruses out there. You could be standing 100 feet away from someone who has measles, and they can cough, and you can get measles from them, even as long as 2 hours later. And even though 91% sounds like a very large vaccination rate, when you have such an infectious disease like measles that carries so far and that is so infectious, 91% isn't nearly enough to give people protection. Even people who've had the 2 doses of MMR vaccine, which is 97% effective, can be at risk when you have outbreaks like that. Vaccination rate is important, and having a higher vaccination rate protects you and your community. And in spite of the religious objections of the people in South Carolina, of which they have one of the highest rates in the nation, about 8%, it is putting the rest of their counties at risk. And as such, now 153 kids have to be quarantined for 21 days, which is typically the maximal exposure from measles that you can have before you develop symptoms. So, measles is a deadly, not just a simple little virus with a rash. It can be a deadly virus. It can cause many problems even years later. It is something that was gone in the year 2000. But because of this persistent anti-vaccination, scientific illiteracy going around, measles is making a comeback because of ignorance.